Welcome back. I'm Jo'Van.
And I'm Brandice.
And this is our brand new show called Closing the Gap. We're so excited that you're here. You're probably wondering, why is our show called Closing the Gap? We live in a time where there's tons of information out there, and it's hard to determine what's true,
what's false,
what's meaningful,
and what will truly feed your soul. We want to create a platform, a safe space for young adults to discuss everyday issues, but with a godly perspective. If you have questions, we have answers. And so this is the show for you.
So sit back, relax, and enjoy.
And if you haven't already, please like and subscribe. Hit that button
Right now.
now.
Disclaimer alert. Okay, we are not medical professionals.
No.
All of the information we will discuss, we heard on Wikipedia. What?
No, we got from a reliable source, but we ourselves are not medical professionals.
Yeah, everything we say you can find on WebMD. No?
No.
So CDC, what else? But like, yeah.
CDC, Johns Hopkins, Mayo Clinic, things of that nature. So we did get reputable sources, not Wiki or
Right.
I'm not saying WebMD, but it'll tell you you're dying.
Exactly.
So don't go there.
Yeah. There's hope. There's hope on this show.
There's hope.
Yeah.
Yes, we have hope for you. So, today's show we're talking about COVID. We've been dealing with this for over a year now, but I think it's something that since we're still dealing with it, we thought it would be important to talk about it, to give some little guidance and things of that nature. So starting off, I just wanted to talk about some like the COVID theories because there's some crazy things floating around out there, guys. And I just wanted to go. Well, first, the biggest one, COVID doesn't exist.
It doesn't.
It does.
What?
It does. There's over 100 million people that will say that differently.
They got the COVID.
They got the COVID.
Oh my god.
So, I don't understand how that one's still lingering around. Like in the beginning, I can see, but maybe. But now, after a year of dealing with, do you think that the government just wants us to stay at home and not spend money, the economy to crash? Like, what is going? Like, what? People actually dying. People.
You know, on a serious note, I can definitely see why people that come from like a small town can easily believe COVID doesn't exist, because it's like, how likely are you to get exposed to it? You know what I'm saying? But if you live in a really populous area, then COVID is very real because there's people from all over interacting with you. So that's how I see it still being around. You know what I'm saying? Especially in the
people. Well, now a year later, people in small towns have got it too. So it's not just. Yeah. I mean, in the beginning, definitely. Like, it hasn't touched me yet. I haven't seen anybody, but we're dealing with this for a year, people.
Hey,
over a year.
I haven't gotten COVID yet, so I kind of believe it doesn't exist, or else I'm just dodging it. I'm just like, not today.
Oh, I haven't had COVID either, but if you take the proper precautions, which we'll talk about, there's a way. But it exists, so please take those proper channels to protect yourselves.
Right.
Another theory was COVID is no worse than the flu, or the same amount of people died from the flu. So I was just like, yeah. And at first, I mean, that one, you can be like, well, if you don't look up the facts, you're like, that's true. People do die from the flu. But I had to look this up because I was like, so I have the facts.
Give me them numbers, girl.
So, globally, there has been 2,891,145 people died from COVID.
Wait, how many numbers? I mean, how many people?
2 million. Over 2 million. 2.8 million.
2.8 million. Okay. So.
From COVID.
Wow.
Deaths. Not diagnosed. These are people who actually died.
How many infections? Do we have that?
Yes, I do. I came prepared, sir.
Look at Brandice.
Yes.
Okay. Closing the gap on COVID. All right. Go for it.
Are you ready for this number?
I don't know. Am I?
Listen.
Give it to me.
Over 133 million cases.
So 133 million
Cases.
and then cases, but 2 million infections.
2.9.
So basically 3.
Yeah.
So the death rate is.
But well, this is going based on the theory that is up to closest flu. So I want to give you the flu numbers so I can disperse that theory because it's not true.
Okay.
So globally, on a regular year, the flu can kill up to 290,000. The max can be 650,000.
Wow. So the fact that COVID's at 3
million globally. So yeah.
Wow.
In the U.S., I do want to give this number really quick. So in the U.S., COVID has killed 559,000 people. In 2019, for the flu, 22,000 people.
And I don't know if we have an answer for this, but that makes me wonder: is COVID so dangerous because it doesn't have the groundwork laid out like the flu has? Like we know what the flu is, so it's easier for us to fight it with vaccines and the flu shot and things like that. But with COVID, because it's so new,
well, it's still like that, and to me, it's so still unpredictable because you can catch it and I can catch it, but have like totally different symptoms.
That is true,
and that was the scary part for me because, like, yes, for one person, it could be like flu-like symptoms, and you can be fine after a couple days.
That's true.
But then there's some people who were literally, they might not have gone to the hospital, but were like in dire, sick.
Yeah, there's some people that they got COVID and they had like a cold almost, and then they were fine. But then I know this one guy. When I say he's the healthiest person I know, but he's swole. He was like 280, just all muscle. And when he got COVID, he lost like 50 pounds.
Yeah, and to the people who had just like cold symptoms, there's still things that happens to your body that COVID did. Like there's one guy, I think he's a teenager. His symptoms when he had COVID was very mild. He just had like maybe shortness of breath and a little whatever. But he didn't know it teared at his lungs. So after he recovered, he was going on about his business. He was a basketball player, and then he died because of the side effects from
that guy from Georgia State.
I don't remember the scores, but I do remember.
I've heard about that.
Yeah, and so that was the scary part. So
Yeah.
the thing is, that's all we want to make sure that everyone's safe and just taking those precautions because, yes, you might just have the light version of it where you just have the flu, but you don't know the aftermath of it. Or
that is true. There was also, I know someone whose child, they had COVID, and the child recovered from it, and really no super bad symptoms or anything like that, but she got it. And then a few months later, she started getting a fever. And it's because some children, I've heard, they suffer an after effect from having COVID, even after they've recovered, because it does such a toll on the body.
Yeah.
So I understand what you're saying was like, there's so much still that's unknown about the virus and how it affects you later on.
Yes. So we don't want you to gamble with your life or your loved one's life or your neighbor's life, saying, oh, you'll be fine, you'll recover, it's just like the flu, and you have like a cold or whatever. That's not the case. You just don't know. I mean, you might have been blessed and lucky to just have those mild and no other aftermath, but you can't say the same for your loved one. I mean, there's over almost 3 million people died. This is something serious. I mean, I don't know. So, but yeah, so it's not just like it had more deaths than the flu, I should say. So we can rule that theory out.
Right.
I wish we had like a little stamp like false.
Maybe we edit it in later, just like false.
This is
and I'll be the voice.
Myth.
False.
You can get. There's another theory that you can get COVID from eating Chinese food.
See, that's
now,
just
this is the most ignorant.
That just sounds. That's just racist.
No, for real, and it's ignorant, and I'm not even going to entertain it with more information, but because, yeah, it's just racist, ignorant, and like.
No, nothing's going to stop me from getting sweet and sour chicken and sesame chicken and salt and pepper shrimp. Nope.
Yeah. But there were a couple of celebrities out there giving some fake news out there to people.
What? Who?
Your boy T.I.
Why you say my boy? You like T.I. more than me.
What?
Weren't you just like second ago? Weren't you saying that that's like my favorite artist of all time, like better than Whitney Houston? And she was going off, y'all. She was talking about
Y'all,
T.I. like he was Michael Jackson.
those are lies. False news over here. Myth. Boom. Stamp
Hey.
you. That is not true.
Okay, maybe I might have exaggerated a tad, but just a tad, people. Just a tad.
Anywho, so T.I. was telling people to just drink tea, and they won't get COVID if they drink the tea.
What like echinacea? Because echinacea does make you feel better.
I don't know. I mean, it's T.I. It was just regular tea. Like, no, okay, it wasn't regular tea, but it was like, it wasn't any like health, like nothing behind that tea that doctors were still going. He was just saying, "Oh, I'm going to drink my herbal tea," and
That makes sense. But if you think about it, he wants to drink tea,
saying it will boost his immune system.
and if you think about it, his name is T.I., so it's like T, and then he's talking about himself, so it's I, so T.I. So he really wasn't telling everyone to do that. He was speaking about himself.
Okay.
This is deep stuff, guys. You gotta think about it.
I also heard that people were saying if you drink a lot of water, it would just flush it out your system.
That's what I heard that too. It was important to drink a lot of water to flush it out, but is that not legit?
People say that when you're taking medicine, so you can like flush it through your system. But I don't think it's the same for actual. But again, I'm not a medical expert, so but I don't believe that's true. If that's the case, a lot of people would have been okay right now. I didn't hear that as a cure for it either. So there's that. Yeah. I mean, water won't hurt, but I don't think it would cure it or help you along.
I think, yeah, I don't know. WebMD.
You're dying. One more theory before we move on. And this was like, that if you got the vaccine, that you were getting the mark of the beast.
And honestly, if that's the case, genius way to spread the mark of the beast, by the way. What are you going to do, not get the vaccine? That's how they get you.
And they were tracking you. They putting other stuff in it too. But the thing is, I believe you will have to make a conscious choice.
I was just about to say that.
It's not something they're going to like trick you.
Right.
Like, oh, I didn't know I was taking the mark.
Right.
No, you're going to know.
Exactly. And that's what I was going to say. It's like, okay, if you take, let's say hypothetically it is the mark of the beast, right? Well, if you don't know, you're not aware, how can you be held accountable for that? You know what I'm saying?
Exactly.
Because you're supposed to make a choice. You're supposed to make a choice, right?
Right.
And yeah, so I don't know. That's but hey, if that's how they were doing it, it's just like everybody gonna get it now.
Yeah, no. And I do have one more. I'm sorry. I want to say this one more because I heard this a lot, that COVID was created as a biological weapon. That it was created in a lab for
But that was debunked because they found it naturally in bats. Like they just found it. It wasn't.
Well, that was another theory. I don't know. Is that true? The bat story. I don't know.
Oh, well, the part that I heard that I don't know if it's true is that someone ate a bat.
Yes. No, that was part of the theory that I've heard a couple of times. But
right.
I was reading as I was doing that might not be completely true either.
Yeah, I don't know if that's true, but I did hear that it did originate from bats, and that's why it's not considered to be a man-made thing.
Yeah. So I know you guys heard a lot of theories as COVID progressed and throughout this year. So please let us know some of the theories in the comments that you've heard. No matter how crazy they were, I really want to hear some of these theories.
Same. Drop them. So we're about to discuss some commonly asked questions in regards to COVID. And I'm going to start it off with Brandice. If you've already had COVID, do you still need to get vaccinated?
Yes, definitely. After you have COVID, you will have antibodies for a while. What they're saying is 90 days, But there have been people who have antibodies for much longer. So you definitely want to get that tested to check your antibodies to see if you still have them. But you definitely still want to get vaccinated.
Agreed.
So,
Agreed.
yes, people get vaccinated. Alrighty, I have a question for you, Jo'Van.
All right.
Can you get COVID-19 after you've been vaccinated?
Absolutely. Absolutely. Yeah, I think I don't know the science behind it, not a medical professional, but yeah, what we've researched is yes, you indeed can still get COVID after you've been vaccinated, but you will now have the necessary, antibodies to fight it off. I think it's kind of like when you get the flu shot,
Yeah.
it's just a weaker version of the flu, so it can.
Well, the COVID is you're not getting COVID though, so that I want to make sure that people are aware. They're not injecting you with COVID, but they are getting you RNAs that help your body to fight it. So just want to put that out there because people are like, oh, they're putting COVID in me. So just wanted to
Hey, that's
clear
great
that
information. That's great. That's dope. Because honestly, like I just learned something. So
there you go.
dope. Okay. All right, Brandice. I've been hearing that there's different types of vaccines. It's not just the vaccine. It's several different ones. So what are the different types of vaccines that you can get?
So here in the U.S., we have Moderna, Pfizer, and Johnson and Johnson. There's a couple information about each one I wanted to give the people. The people, I have information for you. So, the effectiveness for each one. So for Johnson and Johnson, the effectiveness so far is saying 66%. Pfizer is 95, and Moderna is 94.5.
Why would you get Johnson and Johnson then?
Well, it's still effective, and I think there are still more studies. So it's just later to the game. So that's all. So
I'm just thinking if I get to choose between the 96% effective and then the 66, that's like, do you want a 96 on your test or a 66? I think it's a no-brainer that you go with the 96. But
one reason some people are going for it because it's a one shot and you're done.
Oh, okay.
As opposed to both Pfizer and Moderna, you have to get 2 shots. So the Pfizer is 2 shots 3 weeks apart. Moderna is 2 shots 4 weeks apart. So some people like.
And then Johnson is just one shot.
You're done.
So for the people that love needles, they would go with Moderna and Pfizer.
Mm-hmm.
Got it.
And all 3 of them are FDA approved, so authorized. So just want to put that out there. So it is safe. They have been FDA approved. But yeah, and none of these again are giving you COVID. And there's just a couple different ways you have to store the vaccines for each one, but that's not anything you need to know. I just wanted to make sure I give people the effectiveness and let them know that they're all FDA authorized.
I like my vaccine like I like my meat FDA approved.
I didn't know what you were going to say. I thought you were going to say something with the percentage or something.
Or like medium rare or something like that?
Yeah.
Okay, no. That wouldn't make any sense.
Well, it's not fully done, but you want it a little bit more done.
Oh, that's a bar. Ever since you picked up the microphone, you've been rapping, you know what I'm saying? You've been dropping bars. Okay.
I can out with this guy.
All right.
Alrighty, Jo'Van. One final question for the people.
Okay.
Why do you think there are some fears in the African American community about taking the vaccine?
Well, we African Americans we've been through some things with our government, and it's hard to put your trust, especially I feel like the older generation, they've seen things like the Tuskegee experiments when they were giving black people syphilis. I believe it was syphilis. Yeah, and it's just like, I know times are different now, but that has an impact on culture.
Yeah.
You know what I'm saying? Or a lot of you talk about like the Reagan and the cocaine and all that stuff, and like, people still believe that that stuff was planted in the communities to destroy the community. So, which I don't know if that's true or not, but so it's just like, but it all ties back to the government and how they will just do whatever. So I don't blame the the African American community for being skeptical. So that's how I feel about that. Yeah.
Yeah, I mean, yeah, I can see the hesitation, but I do want to make sure that people are getting informed. Do a little bit more research. I hope this answered a couple of questions for you guys, especially knowing that they're not giving you COVID, and demything some of those theories, debunking some of those theories. But please do your research. They have done a lot of studies, and a black woman actually helped create one of, I think it was the Moderna, if I'm not mistaken. So
Okay.
there's that. And I actually got my final shot on the 19th. So I got the Pfizer. So I'm good. No symptoms here. So I'm not quacking like a duck. Don't have another tail or anything. You see anything weird?
You've been a little off. I'm not gonna lie. I don't know if I want to get that. I might get the Moderna because you've been a little.
How?
I don't know. The mics have fallen off the stands, and there's a force. It's like a force around.
I'm more powerful.
Oh my god.
No, but no, seriously, guys. Please just do research. There's a lot of research out there. There's a lot more people taking it. So just be safe. Please continue following guidelines. Even if you want to hold off a little bit, that's fine. But please continue practicing social distance and wearing your mask. If you're not going to get it, please double mask, especially now that the mask order has been lifted. Continue wearing your mask and doing all the things to protect yourself. If you want to wait a little bit, that's your right. I get it. You want to get more information, but please just continue doing the right practices. But the vaccine it's nothing wrong with it, but you have to do your research for yourself. So to shed a little more light on COVID, we are speaking to healthcare worker, a dear friend of mine, Cicely McElrath. She's a lead medical technologist at UAB, and we're going to talk to her about COVID and her experience. Hi, Cicely!
Hey!
How's it going? Looks like you were working today.
Yes, I actually just got off.
Oh, Lord. Oh, well, thanks for carving up some time for us and answering just a few questions dealing with COVID. I know that it's been a crazy time for you this whole year. So, yeah. So the first question is, how did COVID impact healthcare workers?
I think it really depends on what hospital you work in. I had the what do you say? I guess pleasure of working in 2 different hospitals during COVID.
Oh, wow.
One private, and you could barely tell COVID was happening, and even the staff felt that way. They were like, COVID, it really isn't that as bad as we think it is. They had a COVID unit where they put their COVID patients, and it was just kind of contained to that. The rest of the hospital went on about their business. And then you go to my hospital where I work full time, and we had turned our waiting rooms into patient care areas. And
wow.
Not just like our waiting rooms, our lobby got turned into a patient care area. So the public could no longer come into the lobby through those entrances, because that was now where we were housing, like the pre-screening of our patients, the stuff we used to do in the waiting room of the ER. So I think it really depends on where you worked to know the impact, but COVID was very much real. It very much led to a lot of burnout. We saw a lot of burnout in the ER, just because it was, the putting on and putting off, taking off of, personal protective equipment, like the suiting up to go into a COVID patient's room, and then coming home with the fear. I remember one time in clinicals, actually got exposed to a patient. They're like, so you need to quarantine from your family, and I have little kids at home.
Yeah.
And, I have a 1-year old that is still like, mommy, 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 and that was really hard. And by day 3, it was kind of like over for them because they like busted up in the room, and it was just there's no more quarantine. Like, we're just gonna pray about this, and make it
Yeah.
through. So all the things you saw on the news where people were staying in their garages and
Yeah.
going through the elaborate routines before they walked into their house. That was very much real for people who worked at like QAB that were getting the brunt end of this pandemic. But on the private side, it was a little more like, oh, COVID, it's a thing. Yeah, it's
Oh,
just
wow.
I say, but we do see a lot more patients being a level 1 trauma center than some of our other hospital partners around the city. So yeah,
Oh,
there's
wow.
different.
Yeah, I can only imagine, especially if you going home every day to your 2 little babies and your husband.
Yeah,
So, yeah, I know that's a lot to deal with in and out. So, oh my goodness. So, but that's good to hear from you because a lot of people think that it wasn't real or they downplayed it. And like you said, they could have been going to like Grandview or some other private hospital where it's like business as normal, but like you go to
yeah.
UAB and it's like, yeah, it's a big trauma and a lot of changes. So thanks for that perspective. What advice do you give to people, especially in Alabama, now that the mask order has been lifted?
Um, I say continue with what we've been doing. I know wearing a mask is super hard. I don't enjoy wearing a mask, but I have to wear a mask, for 10 hours a day while I'm here at the hospital. But I can say we saw some of the lowest rates of like flu and other upper respiratory
Yeah, I've
infections
heard that.
here. Like, wow, this is what masks do for people, like
Yeah.
kind of kept their germs to themselves. But we were only able to flatten the curve of COVID and the rest of this stuff by wearing our masks, by staying socially distant, by practicing good hand hygiene. Like, people were like super vigilant about washing their hands, and I'm not coming near, and that really helped speed up the process of tackling this pandemic. So I say, we and I even think the governor said that like the only way the reason we got here was because we did these things. So I know there's a lift on Friday, but we still have to be smart about some things.
Yeah, definitely. I just wanted to definitely get perspective from healthcare worker because I mean we can talk about it all day long, but somebody who's actually dealing with it in and out every single day, it definitely sheds a different light on it. So thank you for that.
You're
Yeah. Um. So, what do you think about? So, I've heard people ask, like, should they still wear their mask even though they've gotten vaccinated? What do you think about that?
welcome. Well, just from what I've read, with the CDC, like it takes I think about 90 days for even the vaccine to be as effective, whatever their percentage they're guaranteeing. Say like Pfizer says 94% effective against COVID, but there's still like a 90-day, waiting period for it to get up to that 94%.
Oh wow, I didn't even
Yeah,
know
so
that. I thought it was only 2 weeks, or yeah, two a couple of weeks.
no, so I say like do your research on whichever vaccine you received, and make sure you're waiting the allotted time to go be free. Um, you know, yeah.
So, what do you say to people like me who wants us to stick to vitamin C and not take the vaccine? I like my
Love
vitamin C gummies more than you know.
the
What do you
vaccine.
What do you to say to those people?
Well, I'll make a confession. I have not been vaccinated.
Okay.
So,
Join me.
yeah,
Join the unvaccinated.
I'm well. One, I still had my little person to think about. And two, yeah, I don't know. I've just been on, just playing it smart and safe. Like we go out. If we go out, it's to a park that's open, and we really don't go to any crowded parks. We went to our first restaurant the other week, and everything was, socially distant. There was only like two other families in the restaurant, and we were like super spaced out. And they had like paper on the tables, like paper tablecloths. So I was like, okay. But yeah, just I say be smart. I think people, our ancestors, had a lot of sense back in the days, and they fought a lot of diseases and stuff with natural remedies. Natural herbs and, oils and all that kind of stuff. So I say be smart, wash your hands. I mean, COVID is transmitted just like the flu is. And I mean, there's lots of years we go without getting the flu, personally, like yourself. And that's through, washing your hands, covering your mouth, not being all up in someone's face who, is sick or, So I think I mean, it's a risk I'm taking, not being vaccinated. So,
Yeah, no, I agree. I mean, I agree. It is a risk. Um, at the same time, I've never gotten the flu, knock on wood, and I've only gotten the flu shot one time. So, like, I went so long without getting the flu that I was just like, do I need this flu shot? I don't think so. The only reason I got it is because the people in my office were like, herd immunity. And I was just like, okay, well, it just made it uncomfortable to not get one, so I got it. And that's probably how it's going to be back when we go back to the office. But I really don't want to get one, honestly. But I was going to ask you, children, are they getting vaccinated? Like, or is this mostly for adults?
yeah, so there have been no studies in children, and so children
Mm,
are vaccinated
okay,
just because their immune systems are less developed.
right.
Well, everything's less developed, so there's been no studies. I know there are currently studies going on with like pregnant women and breastfeeding women, and and so they're following those women that are pregnant, through delivery to see, how their children fare, um, with the mom having gotten the vaccine.
Okay.
So
This is good information because if I ever get a survey and they're trying to figure out who's taking the vaccine or not, I'm just gonna put in I'm a pregnant woman, and they'll leave me alone.
No, they won't. I was
nope.
just saying they're giving it to pregnant women.
Oh wait, I'm 5.
Oh, you're
I'll just
five.
say that.
Okay.
Yeah, I'll
He
say
There you
has
that.
go.
what's that movie?
Benjamin Button.
Benjamin Button
Yes,
syndrome.
yes, I like that.
You're,
Oh, so what you were mentioning the paper tables and things like that. I got a massage during like the pandemic because I was stressed out. You know what I'm saying? That was stressful. And
yeah.
they massaged me with paper like in between me and their hands, which was not the same.
I was gonna say, was that the sound of that
How did
feel?
It didn't feel like, I went expecting one thing and I was disappointed, but that's what
Well, they
COVID
had to
did.
be safe,
Yeah.
so yeah.
I
So
remember though, and I mean they use their real hands.
Oh, so they just didn't want to touch me, basically. That's what I'm
Pretty.
hearing.
They
Okay.
were unvaccinated.
All right. I know where I'm taking my business now. I'm not taking it there. I'll tell you that.
well, I want people to be safe because I think they were just trying to be safe. I don't think it was anything towards you. But
Right.
seriously, I thank you so much. Hopefully that we're able to reunite soon. I saw you once or for a split second. So hopefully once everything clears up, we can get back to hanging, having our girls' night. But thank you for all you do and helping a lot of people
Yes,
and
thank
giving
you.
us information today.
Thank you.
So thank you,
Thank
girl. And also, guys, this is our winner. So if you have a true face to our winner, and it was not rigged just because she's my friend.
So you
It
took my
was
$50. I put my name in there too several times. So there's something definitely up.
and I took it out several times. So, but yes, Thank you, Cicely. It wasn't rigged. She won fair and square. But I love you. Thank you.
Thank you.
Yes, bye.
Bye. Well, guys, I hope this helps you guys and shed some light on COVID and just open your eyes and makes you think about the vaccine if you're on the fence about it. But again, continue doing the safe practices. Thank you so much, Cicely McElrath,
Thank you.
for talking to us today. We appreciate you so much, and thank you to all the frontline workers and essential workers out there that kept us going through this time. Thank you so much. We appreciate you guys.
Yes, we appreciate you, and thank you everyone for tuning into this episode. Please join us again next week for another episode of Closing the Gap, and also check out our lives that we'll also be doing as well to talk about more current information and things going on in social media. So thank you guys again for joining in, and we will catch y'all next week.